My name is Deborah Loosemore, and I'm the CEO of the West Perry Sound Health Center Foundation. I have the absolute pleasure and honor of introducing and thanking Dr. Margaret Rundle and Mr. Stephen Lister. They are the founding donors for our Community Health Research Fund. Community health research that is grounded in smaller communities like Perry Sound is critical to developing strategies for better health outcomes for the many Canadians that live outside of major urban centers. We are so grateful for the vision and leadership of Dr. Rundle and Mr. Lister. Their generous donation of $1.5 million over 5 years will fund the Complete Lifestyle Medicine Intervention Program. It helps people in rural Ontario learn and adopt healthier habits. Over the course of 22 weeks, participants attend classes and meet monthly with a certified lifestyle medicine doctor, a health coach, and a dietitian for personalized support.
I was very interested in participating in the funding because I think it's important to invest in the staff of the hospital. And this will give them the opportunity to do some research at the hospital in areas of their interest. For our family foundation, I think it has a number of ingredients that check the list for us, and that is self-empowerment, education, and wellness.
And Molly's been such a passionate, as a physician, such a passionate advocate of promoting wellness and preventative healthcare in her patients over so many years, that this really resonated with her and with us as something that's really important for the community. And the bigger picture is that if our healthcare system is going to remain public and accessible to everybody, we really have to up the quotient of, preventative and wellness initiatives like this in community.
And so lifestyle medicine really hits the 5-6 pillars that address those. So nutrition, and if you want your mind and body to be in a good place, you need to know how to give your body proper nutrition. Sleep, what's good for the body is good for the mind. Community support, social support is another pillar. Exercise, gosh, if we could bottle that, the world would be a better place. And meditation and mindfulness. The last pillar is the avoidance of substances. So I think because CLIP is addressing all of that, the more we educate people about it, it also has a trickle-down effect. So clients become so excited about how much better they're feeling that they can then inform others and become teachers, both directly and just by serving as great role models in the way they're living their lives. I also think a big ingredient is gratefulness. Steve and I feel so wonderfully grateful for having our cottage and being up there. And I think with that becomes a responsibility to pay back to the community. I think the hospital has been wonderfully responsive to its philanthropists. And this really gave us an opportunity. They met us where we were, right? And saying, well, how can we help the hospital and vice versa? So that was very important to us.
And we really hope that it serves as a model, prove out the data from the healthfulness of patients and better outcomes and faster recovery times and less readmissions and so forth. People will feel a lot better, they'll do a lot better, and it'll save our system a ton of money and enable it to continue on. And so we're really hopeful that this Perry Sound will serve as a model for the rest of the province, and that we would really encourage others who may listen to this to step in and help, whether it's, and it doesn't have to be money, it could be donating time, it could be encouraging others who are fortunate enough to be in a position to give, to really consider this as an important part of their philanthropy. I think the number one thing we can do as philanthropists is give back to the communities that we live in. And Perry Sound has been wonderful to us. And so, we want to try and give back to encourage and ensure that whole environment and healthcare support, carries forward even stronger in the future.